Joining us to discuss is Mike Leon, Director of Strategy at the Free and Equal Elections Foundation and host of the Can We Please Talk podcast. And we have Angie Wong, Republican strategist and political columnist. First of all, good afternoon to you both. Angie, let me talk to you first. So the plan that Trump is proposing includes the most favored nation pricing plan, and it gives payments directly to patients, among other things. What do you think is the core theory or the ideology here behind Trump's plan? Is it perhaps consumers first?
It is very much consumers first, and Trump wants to put money back into the patients' pockets by doing his own healthcare plan. I always thought this was the case anyway, because I wasn't part of the Obamacare insurers, but I didn't realize that we didn't really have all these safeguards that protect patients. So this was a great find to finally realize that we didn't already have this. So President Trump rolled out his great healthcare plan on the very day that families had to either enroll in Obamacare, again, at the much higher premiums, or just go without healthcare coverage whatsoever. So this came a little bit late, in my opinion, and it was only one page, which tells me this is just at the conceptual level at this point. So much so that there was a rare meeting yesterday between President Trump and Chuck Schumer at the Oval Office to discuss this. And Chuck Schumer was asking him if he could help and just get a 3-year extension on ACA subsidy extensions, which I'm sure President Trump does not want to do. All of this signals to me that President Trump and the House Republicans, they do not want Obamacare to exist. They want it to go away. They want to replace it with Trump's new plan that is way better for all Americans and patients. We get to decide now.
Okay, Mike, where do you stand on this great health care plan? Do you like it? Do you not like it? Give us your thoughts.
Well, first off, good afternoon to see you guys today. Don, I'm a little hurt. You didn't come to me first, but ladies first. I get it.
I'll end with you, Mike.
Thanks. I appreciate that. So, I mean, a mixed bag of emotions, Don, right? Like with healthcare, we've talked about a lot. There's over 55% of people in this country that get healthcare through a W-2 job, right? As opposed to people that are on Medicare and Medicaid, which this would target. So we haven't really covered how we would attack ones that, insurers that people get through their job, right? So that's number one. Number two is we're unsure, to Angie's point, this is only like a 4 or 5 point bullet point plan, but we really haven't drilled into the details. Like, how much money am I going to get to be able to afford, said insurance plan? I do agree with the parts of making things transparent to the consumer, because if you're going to put money back into the pocket of the folks that are going to be able to shop for insurance, they need to know how much procedures are going to be. The problem is going to be, Don, we're going to see potential markups in that industry. And this is one thing that I think the president and I actually agree on. And I know Mark Cuban has done something about this as well with his company to tackle, the middleman in the pharmaceutical game that's charging outrageous prices and who can actually buy the prescription drugs and whatnot, who can get access to those prescription drugs. So it's a mixed bag, as always, with anything that I read from the president or comes out of the White House. There's a couple of good things in here. There's a couple of things that need more detail that we still don't know about. And then there's people that may not be protected, pre-existing conditions, ones that are still on their employer's benefit insurance plans. So there's a lot that's still unknown. I think this needs a little bit more work before it's unveiled fully to the public.
Okay, so Angie, what do you think of some of the concerns that Mike raised, like whether people are going to be covered, markups as well? Your thoughts?
Yeah, Mike is absolutely right. We all want transparency. I'm surprised that doesn't already exist. Look, what I'm looking at right now, as of today, people's healthcare premiums either went up or they have no coverage if they were already existing Obamacare insured. Americans are now paying $2,000 a month for a family, and that's just the basic bronze plan. That's $27,000 per year out of pocket for a lot of American families. That's just unaffordable. So I have a feeling all this will be done away. Now, what I like about President Trump's proposal, and it is just conceptual, is that he's got Trump RX. You could buy favored nation price drugs directly through the government, which is going to be a lot cheaper for everybody. And also the fact that there's going to be drug price reform, healthcare reform, price transparency, fraud protection. I mean, all of this just sounds really great. But, Mike is right. Congress has to really spell out the finer points. President Trump put out a one-page idea, and I think that's where we can build on it, but they have to do it fast because I can't imagine families now going without health care insurance for weeks, months going forward. This has to be implemented right away. Now, it's really about our job, which is get the messaging out and say this is a good thing. I don't care if you're right or left. We do need health care insurance for all Americans. How do we do this, and how do we do it fast?
Okay, yeah, let's talk about Congress. Mike, how do you think this plan will be received?
Yeah, that's a great question, right? There's been a lot of bipartisan compromise on this. I think this is an issue that, Angie and I have talked about before that people don't want to tackle in 26 if they have to go out on a campaign trail. And, the Republicans have to go out there and say, we haven't done anything. We have outlines of a plan. We have concepts of a plan. We heard that in 24. We heard that all throughout Donald Trump's, entire time in American politics in terms of what he campaigned on. We still don't have anything. And to Angie's point, we have an outline of something, but we still don't have anything. Now, here's one thing I will say about this. There's a couple things that Angie mentioned there that I think Congress won't go for, or at least I wouldn't go for, or let's say someone like a Thomas Massey wouldn't go for. And that's the government setting prices and doing things like that. The government is not meant to do that, in my opinion. Again, this may be a libertarian type take, Don, so take it with a grain of salt. Like, what I think the president is trying to do is exert pressure on the people that have the most power and skin in the game. One is, like I mentioned, these pharmaceutical managers, the middlemen in this company. But then it's also the insurance providers and carriers that carry enormous weight in this game. And they're the reason why, let's be honest, a lot of things are unaffordable and why we have so many millions of Americans that are on medical debt post all of this. Like Angie said, if you either opted into higher premiums or you have no insurance, God forbid something happens to you right now, case in point, me, myself, I go outside right now, I don't have current insurance. My kids are covered under a different Florida plan, but I don't have any insurance. I get hit by an air conditioner outside my hotel room right now, Don, I'm going to be screwed. And I'm going to be racking up debt because I'll be one of those millions of Americans that's under medical debt. But I can't afford, like to Angie's point, the $2,100, $2,200 a month it is to cover a family of four under an Obamacare plan, whether it be Fidelis. And I don't know if a doctor will take that. I don't know what hospitals will take that and what levels of benefit of coverage come with that. So there's a lot to that. I think there's members of Congress, some that are doctors themselves, Bill Cassidy is an example, that know how important that this is. And I think you're seeing a lot of bipartisan support and swelling to get behind something. It doesn't matter if it's the 47th president or if it's the next president. It's get behind this because millions of Americans are going to be left out in the cold. And we've got an election coming up and we can't afford to let that linger until November.
Okay, so Angie, similar question to you. Which parts of the plan do you think will see the most bipartisan support, and which do you think will see more debate or opposition?
Yeah, we're already seeing Chuck Schumer and other Democrats just pushing the narrative as if Trump never rolled out this plan to begin with. They're having meetings and conferences about extending ACA subsidies still. And I think that's where it's going to be really interesting because that is a bipartisan committee that's been put together to talk about an extension of ACA subsidies. But President Trump kind of threw a wrench in all that yesterday by introducing his own plan. So I think now it's just it's going to be a race to whichever one gets more traction. If he can make this really work and if he can really spell it out and congressional members can get on board with his plan, we're going to go with that. I think it makes perfect sense. We want to pay lower drug prices. We don't want to have insurance fraud. We want to have control of our health care for patients. So I think those are all good things. But at the same time, are we going to also then extend ACA just so all Americans can have something during this discussion? Because I can't imagine, even though I'm sure Trump administration wants this happen tomorrow, I don't think it's going to happen even within weeks. I think there's going to be a lot of discussion, a lot of back and forth between the two houses on the Hill. And then it might take months before this actually gets done. So do we extend ACA? I think that is the question on the table right now. Do we extend it by a year? 2 years or Chuck Schumer wants all 3 years. That is going to be the tough one, because me personally, I want to see Trump's great healthcare plan rolled out by the end of the month. But I know that's not going to be realistic. But at the same time, how much room do we give this ACA subsidy extension if that is the only path forward? No idea.
Well, Mike, we certainly hope you don't get hit by an air conditioner outside your hotel room. We've been really enjoying your comments on this program.
Thank you. Appreciate
but
that.
Joking aside, you brought up the midterms in your previous response. Do you think this law will have any bearing on the midterms? Because President Trump recently said during his speech at the Detroit Economic Club that they should win the midterms for most favored nation pricing alone. Your thoughts?
Don, I don't agree with that at all. Look, this midterm elections, of what the president said, not of the question you asked me. This midterm elections is going to be a referendum on the ballot. Mike Johnson has already said, even though Trump is not on the ballot, everyone knows that if Democrats win back the House, they're going to start impeachment, and they're going to try to impeach Trump in the second term. That's going to, in the second half of his term, that's going to be what Republicans are going to run on, right? So far, it depends on where the economy will be come October / going into November. That will weigh in. This is a huge thing. This is millions of Americans that rely on these two programs, millions of Americans that rely on these subsidies, and an extension of it would, in essence, to Angie's point, admit defeat on this, right? So if Chuck Schumer gets what he wants, now Democrats can take that on the road and say, look, we fought for health care for you. We've got the subsidies extension here. These are the other bad things Donald Trump has done, i.e., invading a country like Venezuela and taking oil, things like that. I not necessarily agree with it. I'm just telling you things that they'll campaign on. And plus, we want to take back control of the House and the Senate. So I think it will have a long tail effect, to Angie's point, and this is why Angie's brought it up several times. You got to get it out the door faster. Bullet points and outlines are things that were discussed in the September debate between Kamala Harris and Donald Trump. Now here we are, my math sucks, Don, 16 months later, and we have, 4 or 5 bullet points, of which some people agree with, but you've got to flush it out a little bit more. So how are you going to flush it out if this is what you're giving me after 14, 16 months? How much more time do you need? And I don't think, as a strategist, Angie, you can correct me if I'm wrong, I don't think as a strategist that's something you would want a candidate to go back out locally to constituents and be like, look, we've got a plan, we've got an outline, where is it? They're going to be asking, where is it? I've had members of Congress on my show. They get yelled at town halls all the time. Where is it? Where is it? And so I think they don't want to let that last. And I think that's going to be what could be determining. It's only one of a series of factors, Don, that people are going to take with them into the ballot box if they don't have any health care insurance.
Angie, your response.
Yeah. Well, I'm thinking about this a little bit out loud in that both sides, it appears to me, they don't want this to be the topic A, right? They really kind of want to get this thing done and get it done on a much quieter level than we saw last year, right before the government shutdown, when this was the big topic. This time around, it feels a little bit different. A lot of backroom dealings, a lot of stuff happening behind the scenes, because both sides know that this could hurt them potentially, right? And both sides understand that this could cancel their chances of winning during the midterms if they get it wrong, because there's really no real happy ending here. Someone's going to have to pay something, the government, the patient, the father, the mom, whatever it is, there's going to be payments out. It's not going to be a great thing where it's like, okay, everyone's got free healthcare, which is pretty much what a lot of Democrats want. So I think a lot of people, I think this will be an issue, but I don't think this is going to be the issue for the midterms. I think it's going to get done a lot sooner and a lot quieter than we think. I like to think that there's going to be some interim ACA subsidies that will get rolled out just to support Mike and his family and everybody else, so that no one gets hurt and no one has, medical debt, because nobody wants that. And I think that is just, we're in that perfect storm moment right now where anything can happen, and that's going to happen to Americans. So that's going to be good. But I think Trump wants some sort of guarantee that his plan is going to go through, or at least parts of it. I think the Trump RX is already well on its way. That might be separate of Obamacare and a replacement for Obamacare altogether. That's a separate thing. So there's a lot of those things that, I'm still looking at the fine prints, because I think my read of this situation is that they want to replace Obamacare altogether. They're saying this is, not working. This is the unaffordable healthcare plan. Here's my plan. But at the same time, not every single line item is complementary to the Obamacare. It could be a separate thing altogether. It might be an alternate plan. So that's kind of what I want to understand out of all of this. But yeah, we're trying not to make this a big midterm issue right now, only because both sides get really hurt by it.
Okay, Mike, sorry for not starting with you, but you get the final comment.
Final comment is this, Don. If you've been following this Trump plan for the last few years and you're still saying, where the hell is this plan? At least today, you got a little bit closer, but I don't think close enough that what Republicans want. And I think I will echo what the Republican strategist said on this panel. This is something that people don't want to linger. This is something that we're actually seeing a groundswelling of bipartisan support to make sure that this isn't an issue for either party at the ballot box. You can't leave any stone unturned going into 2026. It's a pivotal election, Don. And I think they don't want healthcare to be any issue on the top four as people head into the ballot box.
Well, all right. Always like talking to you guys. Thank you so much today.
Thank you.
Thank you, Don. Thank you, Andrew.